I believe are here. You are there. Can you see my arrow, my cursor?
Yeah,
Are you
sure.
able to? Right. Okay. Most of you are here in the healthy state. Hopefully, I hope none of you is sick. But what is the role of pathologists is to understand why sick people like you right now become sick. And we also we will also teach you in pathology how can we make the sick person go back and become normal. What are how do you make the sick person go back to normal? And if the sickness is very bad and very chronic, finally died, the patient died. So we'll also teach you what happened, what made the person die. So essentially, physiology, what you need is in pathology is actually we are telling you about how to understand sickness and then and cure them, make them go back, patients go back, become normal. And then if it is too bad, what are the factors that lead to death? So that is essentially what we will be teaching you. And as I put here, man is the architect of his life. Actually, you are the one who is supposed to take care of yourself. So, later on, I will tell you why I say this sentence, man is the architect of his life. Okay, what you need to know before you learn pathology, you need to know anatomy. You have to understand what body parts I'm talking about, we will be talking about. You would have to understand histology first, the physiology, the function of the body, how the body function. Yeah, you need to know all those and biochemistry, because these are the building blocks of knowledge that you need to know before you understand pathology, because pathology is study of diseases. Then why do you learn it? As I said, it's a basis of diseases. You are going to be a doctor, you must learn about diseases. Unless you be a doctor just because you want the title, you don't want to treat patients, that is fine too. A lot of people just do that. Actually, they just want to take the title DR and then don't want to become doctor. I hope not many of you are like that. Okay. And then we will teach you how organs and tissues, you know what is the difference between organs and tissues, right? Tissues made up, a lot of tissues made up organs, and I will elaborate further. Okay, so why we learn pathology is because we want to understand pathogenesis. Pathogenesis is you see the two words here. In pathology, we'll teach you a lot of these big words. The pathogenesis means how disease, genesis is development. So how disease is developed. So we'll we'll teach you a lot on pathogenesis of so many diseases in our body. Okay. So how organs and tissue in a healthy person change from normal to abnormal, that is pathogenesis. And then when they are sick, they have symptoms and signs. Symptoms is what the patient complain to the doctor, okay? And signs is what you doctors see in the patient. So these are I hope you understand it. Symptoms are what patients complain to you, and signs are what you as doctors see in a patient. So the symptoms and sign is called that you will see in a patient when you look for it. And in pathology, we call it pathophysiology. Physiology is the function. Then there is pathology, disease. So what happened when the patient is having disease? There'll be altered function of the body. So we call it pathophysiology. So pathophysiology, physiology is function of the body, but when there is pathophysiology, is altered physiology, altered function of the body because of the disease, right? I hope you understand me so far. Okay, then why do you need to learn it again? Because as I said, we want to teach you to treat your patients so that they can revert back, become normal. And then we also will teach you how to prevent from getting certain diseases. What are the risk factors of certain diseases? And then like for example, right now, COVID, everybody is talking about COVID, right? So what are the risk factors of people will get severe COVID? I'm sure you all by now know so much about COVID already. So you know what are the risk factors of the people who get bad COVID infection? And then we also will teach you about screening. Some diseases can be screened, breast cancer, can be screened. Cervical cancer can be screened. You know, many diseases, not many, there are some diseases that can be screened. So we screen them so that we can detect them before the patient get the disease, so that we can, they can be aware of the condition. And if I have to warn you, if you do not know pathology, you cannot become a doctor. So you want to be a doctor, you have to promise yourself, you have to learn pathology. No excuse about that, okay? So you have to learn to understand pathology. So cells in the body is made up of many cells, right? And many cells. Many cells, and in fact, before we come many cells, even higher before cells, the cells is made up of organelles, right? And then before the organelles is made up of molecules and compounds, and each of them has a basis, the molecular basis. So all that finally from come together become cells, and cells group together become tissues. Tissues group together, different tissues like cells. Liver cells, for example, hepatocytes, and then we have fibrous tissue, fibrocytes, and all that. So many cells, they form tissues, become liver tissues. They become many tissues made up of different tissues made up organ, liver organ. Okay, then the whole many different organs of the body make up the organism that is made. So when you have disease, what happens is your cells are injured. Okay, the word injury here does not mean he has to be injured by trauma. There are many other things that cause injury. I will talk to you later. All right, so injured, sick or injured cells become injured tissue, become injured organ, become injured organism, become a sick man. So essentially, what you will be learning is all these phases that cause in the cells, in the tissues, in the organs, finally that make the man sick. So that is what you'll be learning in pathology. Okay, let's look at cell. Normal cell have a nucleus. The only normal cell that do not have a nucleus is red blood cell. Okay. The rest of the cells in the body have nucleus and have cytoplasm. All right. And some have nucleolus. No, not all of them, but when young, most of them will have nucleolus. So this is normal cell, normal function. This is what you will learn in physiology, biochemistry, histology. The function of the cells in physiology, and then in anatomy you learn to see how it looks like. But in pathology, it will teach you what happened to the sick cell. So we call sick cell degenerated cell. So today you learn one new term in pathology, degenerated cell. Degenerated cell means just sick cell. So pathologists like to be very grandiose, we call it, hi-fi, so that people don't understand what we are talking about. But essentially, it is degenerated cell, means sick cell. And they will have abnormal function. And when this cell become very sick, they become dead cell, and dead cell, necrotic cell. So I don't know whether you have listened and heard of this term necrosis before. Necrotic cell is dead cell when dead cell have no function. So that is essentially the stages that you will be learning. Okay. So what are the definition? Pathology is study of diseases by scientific method. It's not like you go to Bomo and say, oh, you go to Bomo, they rub your whatever sick part of you. Oh, ini because of that Mr. so and so buat ni, cause you to have disease. Oh, you have gone, all that is not scientific at all. Okay, so pathology is study of disease by scientific method. Disease may be defined as an abnormal alteration of structure or function in any part of the body. So that is essentially, you know what that is, but sometimes you just don't know how to put it in words. Okay, now let's look. I want to and make you understand this, because most of the questions that we will pose to you come from these few slides that I'll be talking to you. Okay. Now, from now on, put your mind to talk using this term, etiology. Etiology means cause of the disease. That means the root cause. Etiology is the cause of the disease. Okay, so for example, I will talk. I will further elaborate later on. Diagnosis, I think most of you have heard of this. Diagnosis is the name of the disease, right? pathogenesis, I've mentioned to you briefly just now, is the mechanism of development of disease. In pathology, we will ask a lot of this. What is the pathogenesis of cervical cancer? What is the pathogenesis of nasal polyp? We'll ask you so many questions on pathogenesis. Remember, pathogenesis is development of disease, how disease develop. Okay, pathophysiology is the alteration of the function after the disease develop. Okay, the functional consequences of the morphologic changes as observed clinically. Remember that if we ask you on pathophysiology, don't just answer on pathogenesis, will be different. So then pathophysiology, you must include the morphological changes as observed clinically. What happened to the patient come to you? And then the altered patient, for example, he has something wrong with the liver. So when you see the patient will be jaundice, yellow in color. So that is pathophysiology. Okay, the clinic, you have to include the altered function as well. That means the liver is not performing function properly. Then we'll talk to you about the morphology. Morphology from the word morph. Morph means appearance. So the morphology, so in fact, from now on, you can talk to each other. Oh, your morphology is not very good today when you see your friends a bit depressed. So that is morphology means appearance, external appearance. The structural alteration induced in cells and tissues. All right, next one is epidemiology. Epidemiology is where, that means the geography and what the demography of the disease. For example, I'm telling you, cancer of the skin is very common in Australia. Cancer of the stomach is very common in Japan. So that is, I'm using geography and example. In demography, cancer of the stomach in Malaysia, for example, are common among the Chinese. Cancer of the brain is common among the Malays. So that is, I'm using demography and example. You will learn about this on every disease that we tell you later on. Then prognosis. Prognosis is the expected outcome of the disease. For example, the person have the disease. What happened to this disease in 5 years from now? We have a good outcome or bad outcome? Good outcome, good prognosis. Bad outcome, bad prognosis. For example, a patient, a person who is having, say, cancer lung, say adenocarcinoma of the lung. And the prognosis is bad because carcinoma of lungs spread, grows very fast and spread very fast. So bad. But if the person have, say, a benign tumor of the lung, so that is a good prognosis. So the outcome is good because patient can become better after treatment. So prognosis. In fact, you can use this daily term, among yourself. If you don't study very hard, your prognosis to become a doctor is bad, very poor. Okay. So prognosis is outcome, expected outcome. Then the disease I mentioned to you just now. Okay, Omar, you are smiling, very good. You can know if you have no money, the prognosis of you to have a good lunch today is not good, isn't it? Okay, then the disease. The disease, we will mention to you what are the risk factors. Okay. Then the behavior of the disease, is the disease very will grow very fast or will grow slowly? That is called the behavior of the disease. Every disease have different behavior, and we will tell you what the behavior depends on. Sometimes it depends on the kind of cells that it comes from, which cell it comes from, and sometimes it is due to the condition, the systemic condition of the patient. For example, a patient who have the same disease, one is completely healthy and another is a diabetic patient, for example, the behavior of the disease in these two different patients will be different. Then the microscopy, meaning what are the gross appearance and the histologic appearance seen under microscope of this disease. So we'll teach you all this and how do you treat them. We give you the principle of treatment. Okay, do you follow so far? Raise your hand if you follow so far. All right, so I'm allowing to digest. Okay, good. All right. Okay, Now, I'm going to teach you further terminology. Okay, I have mentioned to you briefly just now degeneration. Degeneration means just sick cell. So the cell uh, that is not normal is just called degenerated cell. The reverse is called regeneration. After they become sick and now they are returning back to normal, that is called regeneration. So a sick cell that is becoming back to healthy, because we can see that it is in the histology, we can see it is now going back. Of course, dead cell will not reverse. Once the cell reach necrosis, dead cell, the nucleus will not reappear. No. But when the cell is sick, the nucleus is still there, the cytoplasm is still intact, and then now the environment around it is removed. That means it be sick, it's removed, and now they're treated. The cells can regenerate, can go back to normal. How they go back to normal? You will learn later on. Essentially, the cells, they divide. Well, I will tell you. Just be attention to pathology lectures. You'll understand, and I will also briefly explain after this. Then proliferation is how the cell divide. Proliferate means increase in number. So cell divide from 1 cell to 2 cell to 4 cell to 8 cell to 16 cell, 32 cell, and so on. That is how they divide, proliferation of cell. Then metastasis is the presence of disease in a distant place when it started from another place. Okay, for example, it started in the skin, but now the disease have undergone metastasis and gone to the brain. So the brain disease is a metastasis, whereas the skin disease is the primary site of the lesion. Do you follow? All right.
Yes, doctor.
Yes, doctor.
Yeah. Okay, so that is what metastasis is. Next, we pathologists also like to introduce fancy words so that we are different breed from other people. One is introducing the word A with something else. Atrophy. You know, troph is from growth. Troph is the meaning growth. So atrophy, no growth. Agenesis, no development. Atypical is not typical, not normal. So we put the word A before that. Atrophy, we will see a lot of this in pathology book. Atrophy, agenesis, atypical. Then we add this. This means anything abnormal. So we put dysgenesis, dystrophy, dysplasia. Okay, all these terms we will teach you in detail later on. Then hyper, I'm sure you have heard of this hyper in hypo in physiology, right? Hypertrophy, hypergenesis, hypoplasia, so etc. etc. Okay, all right. Now the bad thing is, the not the bad thing. The complicated thing about the pathology learning disease is one etiologic agent. Do you remember still etiology? What the cause? One etiologic agent cause one disease. Example, hepatitis B virus cause cervical cancer. So that is very easy to understand. So one agent, one disease. But several etiologic agents can also cause one disease. Example, hepatitis B virus, alcohol, hepatitis C can cause liver cancer. So the disease is one disease, liver cancer, but caused by so many different etiologic agents. Okay, then one etiologic agent can cause several diseases. For example, human papillomavirus, just now I mentioned, can cause cervical cancer, but human papillomavirus can also cause not only cervical cancer, can cause skin cancer, can cause warts in the body, can cause papillomas. So that is the beauty of pathology. A lot to learn. So you will not grow old. You will really like pathology, and I'm sure because it's learning about diseases. Remember I was talking to you about cells and you learn a little bit more about cells. I think you have already learned about labile, stable, permanent category of cells, right? Have you done this? If you not, I will mention. Yes or no? Raise your hand if, okay. If you haven't heard, raise your hand. Okay. So you want me to explain? All right. Okay. Yeah. Okay. Labile cells are okay. Cells in our body are categorized into three. One is labile cells, one is stable cells, and other is permanent cells. Labile cells are cells in the body that divide throughout life. Divide means 1 to 2, 2 to 4, 4 to 8, 8 to 16, 32, 64, carry on throughout life. Example is skin, all the epithelium, all the internal gut epithelium, external the skin, they all belong to labile cells, they divide all the time. Next is stable, that means they only divide when needed. Huh? Stable example of stable cells are fat, liver cells, hepatocytes, these are stable. They only divide when needed. When it is not needed, they don't divide. Whereas in labile, you need or don't, the body need or don't need, they have a lifespan, they continuous throughout life. Stable only when needed. For example, it's cut, the liver is cut, then they will divide because they want to heal themselves. Okay. Permanent cells like neuron, they once they reach maturity, they don't divide anymore. So any injury to nerve cells will be detrimental to the patient. Okay. And this is the detail of the cell structure. You will learn this in histology. Okay, so why cells become, remember the word degenerate? Why cells become sick? Okay, the why cells become sick is due to two causes. Remember, you when I'm teaching you now, you remember you visualize it is you who is suffering to it. Is due to external causes or exogenous causes, that means outside you, and internal causes, that means endogenous causes, that means within you. Your cells can be injured from factors outside you or factors within you. Now I take for example right now, it's raining in Kelantan. Many of you are getting running nose now, yeah? You're getting we call it upper respiratory tract infection. Many of you are getting, cold, running nose, cold. So what is the factors, the external causes? The external cause that be the viruses that are outside that are causing you, the air, the environment around you. The internal cause, not everybody who is during rainy season get, some people are healthy. So the internal cause, the endogenous cause within you, you have good immune system, you have good body function to defend yourself. So these are all endogenous causes. Now, this is what I mean just now. Why do I get sick? You always ask yourself this question. Every time when you are not well, you ask yourself this question. Is it due to exogenous cause or due to the endogenous cause that lead my cells to be injured? Yeah. But remember, there is one more issue that you have to concentrate on. Power of mind over matter. I'm not sure that you can see that, but at the top there. Power of mind over matter. When two persons having same risk factors are externally have same risk factors, but one, even the age is the same, the sex is the same, the environment is the same, the risk factors exposed to that person, the two persons are the same. One do not get it, the other get the disease. Why? This is the power of mind over matter. Sometimes even if the endogenous factors are similar, but the power of mind, this is a very big. I wouldn't go to that, but you remember that factor exists. That is how sometimes you call it the the inner sense of you. Okay, so now what injures cells? The external causes are like, for example, physical heat. You iron your, instead of ironing your clothes today, you iron your body, your skin. So they get heat, the physical heat there, cold. In fact, the moment you touch, the iron touch your skin, you get inflammation, you get changes in it. You get later on when you learn acute inflammation, you will understand what I'm talking about. So these are the causes. Cold can also cause trauma. Trauma is like, for example, somebody punch you or somebody cut you. Okay, chemicals such as acid, alkali, benzene. Biological, virus, bacteria, fungus, parasite. Immunological, for example, autoimmune. Autoimmune means within you there are cells that are recognizing other cells within you that are bad. So they are attacking those cells. So these are hypersensitivity mechanism. You will learn later on. Nutritional, the nutritional deficiency or nutritional excess. Too much of some people take too much of unnecessary vitamins. Vitamins. Let's say for example, vitamin C. Don't you take 100,000 milligrams of vitamin C a day. You said because it's COVID, I want to super immune myself. It won't work that way. Okay, the body have a certain limit where your body can cope with the level of whatever it is you are taking. And the other cause is drug like chemotherapy. Drugs can also cause injury to your body. The internal causes within you could be due to enzyme defects, ischemia, that means hypoxia, that means the blood flow is wrong and it's not quite right. Either the person have low blood pressure or high blood pressure, or due to atheroma, the formation of narrowing of the lumen of the blood vessel going to particular organ, due to immune-mediated injury that I've mentioned just now, or genetic factors. You just do not have the hormones or the enzyme for that particular organ to behave normally. Okay, so that could due to internal causes. How will we teach you to learn pathology? We'll teach you first in a basic form, basic pathology. Then we'll teach you in systemic pathology. I have to remind you, you must know basic pathology before you understand systemic pathology. Systemic pathology means you learn the organs, the respiratory system, you learn about lung and the upper respiratory tract. Cardiovascular organs, you learn about the heart and the vessels. So that is systemic. Whereas basic pathology, I will give you the series of the basic topic that will teach you. And you must know pathology before you become a medical doctor. Okay. So, and you must become a medical doctor before you can become a pathologist. So I became a doctor in 1981. I think you were not born yet. Most of you were not born yet. And I became a pathologist in 1987. And I don't think many of you are born in what year mainly? Because when I became pathologist was 30 over years ago. I think you all were not born yet. Okay. Okay, so these are the example of basic pathology that will teach you on what causes that lead cells to become injured. Necrosis, cell death that I'm talking about just now. Acute inflammation, chronic inflammation, mediators of inflammation, healing and repair, fluid and hemodynamic derangement, cellular adaptation, neoplasia. Okay, so these are basic. You must know this. And then after that, we teach you systemic pathology. Sorry. Sorry. Example, respiratory system, gastrointestinal system, reproductive system, etc. Okay, what are the types of cell injury? As I said, it can be reversible and irreversible. The cause of each is similar. The cause that can of the injury that cause reversible damage or irreversible. Irreversible means no chance of getting the cell become normal. Irreversible. So the cause of each is similar. The degree of damage to cells are different. Okay. Same degree of injury result in different degree of damage in different cells. You remember the three categories of cells I was talking just now. If the damage is to labile cell, not much problem because the cells are dividing all the time. But if the damage occurs on the permanent cells like neurons, then the damage will cause a lot of, the injury will cause a lot of damage. So, same degree of injury result in different degree of damage in different cells. Then same degree of injury results in different degree of damage in different person. Okay, so, like I told you just now, same degree of injury result in different degree of damage in different person. Okay, this is what I was talking to you just now, the mind over matter issue. Okay, so far, are you all happy with this lecture? Are you all following me?
Yes, Professor.
Yes, doctor.
Good, good. All right, now What are the mechanism? This is only briefly on the mechanism of cell injury because each will be covered later on because my job here is just to introduce you pathology and make you understand what exactly you'll be learning in pathology. One of the methods of cell injury is defective energy production. You know what is energy production. You learn a lot of that in physiology. The other is due to impaired cell membrane function. You know, every cell has its membrane, or genetic alteration, or metabolic derangement. That means the hormones in the body is not right. And you will learn more on each disease later on. Okay, what is the fate of the injured cells? If it is mild, it will go back to normal, no problem. That is good. But if the injury to the organ, to the tissue is persistent, it will lead to, the cells will lead to adaptation. You know, like for example, I want to show you. Who usually get blisters with new shoes? You're right. You often get blisters with new shoes, right? But you keep wearing the new shoes, after a while, you don't get blisters anymore because your skin has adapted to it. Okay, so that is called adaptation. What happens to your skin actually when it is being irritated by you buying tight shoes is the skin epithelium undergo hypertrophy, hyperplasia. Okay, these are for skin, it will be hyperplasia. This hyperplasia is increased number of cells. Hypertrophy increased number of growth of the cell. But for the skin, it will be hyperplasia. Okay, for other organs, it will be muscles and all that, it will be hypertrophy. And then, another form of adaptation is atrophy. They just shrink. You know, for example, you tie rubber band on your finger for a long time. First slowly, and then, or maybe you just use maybe rubber band will be painful. Maybe I want, but don't do this experiment because and once your cell atrophy, it will be difficult for you need to reverse it back. Yeah? Atrophy, for example, you know you, if you play games, the one that is easiest is yourself right now. You have two hands, right hand and the left hand. You all, most of you are either right-handed or left-handed. You will notice your right hand, if you are right-handed, your right hand is slightly bigger than your left hand. Okay, tennis player often have that. The tennis players, because they play with very, they have hypertrophy of one hand. So that is called. But if you don't use this hand, one hand completely, you completely refuse to. You tie your hand to your thigh and you don't move for months, and then this hand will become atrophy. So that is the meaning of atrophy. And then there is dysplasia, abnormal growth. Okay. Then if that the injury is, sorry. Oh, okay. If the injury is severe, A cells will be dead, then there's no chance anymore. They just go dead, and they will teach you what are the causes of cell death. All right. Okay, now let's see another thing that you as going to be learning pathology will teach you how to be observant. All pathologists are very observant. Okay, I want to show you some pictures and see whether how observant you are. Okay. Okay, which is the normal? You can see that these two toes are normal, and this is abnormal because the color is different. Because here is easy, there's something here, and there is something going on here. So we know what the cause of this, because of something going on here that leads to the color change. Now, some is very not so obvious. You see these two photos of front and back and front of these two limbs. Which one is normal? This one or this one? This one. What do you think? The one here or the one here? The right or the left? So you will say, oh no, the right is, this one is abnormal because it's bigger. See, no, this one is normal because it looks nice. You don't know until the patient tell you. So some can be very subtle, some is not. Like for this particular case, actually there is atrophy of this muscle here, and that's why the normal is like this now, the atrophy. So that is some can be, you can see, some you don't, not so obvious until the patient tell you the problem. And here you can see obviously one is swollen, the other is not, and you can see the result swollen. And some, of course, obviously the abdomen, even a fat person, the abdomen is not like this. When it lie down, will be, so you know the problem is here. Okay. Now, this is obvious, isn't it? What is very swollen and shiny, this is normal. Okay. And of course, here is so obvious there is hypertrophy going on. And this is normal spleen. You can see nice and glistening, but this is abnormal spleen. You can see due to necrosis here. We later will tell you what it is. This is what we call it morphological change. Morphological change means appearance, what you see. Morphological change. This is the normal gut. You can see the pale pink, whereas the congested hemorrhagic looking, that is abnormal one. This is the normal brain, that is the abnormal one. This is normal lung. You can see the abnormal ones have a lot of consolidation, necrotic areas here and there. And this is abnormal liver compared to normal liver, which is not yellow, which is this one is yellow, right? So this is morphological change. So pathologists, then when you look at histology, same thing. But this is histological change. Now this is normal skin. Now you can see there is a hypertrophy of the skin. And then it become very abnormal. You can see this is a cancer formation. We'll teach you later on. Here, normally it has to be the glands of the organ, like in this case is a uterus. You can see that they are far apart, but here it is crowding area, and here is very different looking. Okay, so these are all abnormal. And the liver also, this is normal liver, and then become very abnormal and very, very abnormal. Okay, so these are the histological change. Then we have the molecular change, the chromosome change, the change in the bases, and all that. For example, this is normal chromosome, and you know there's something wrong with the chromosome because the X chromosome is lost, and it's also here, and here has, three unit there. That is not right. Okay, and sometimes you have loss of this DNA bases. Okay, so what you learn is, okay, abnormality at what is happening to your patient is you see when you become a doctor later on, you are seeing patient who complain with symptoms of the disease. Remember what is symptoms? Symptoms is what the patients complain to doctors. Then you see the patient, then you look for the signs. Signs is what the patients have that doctors see. Okay, then you diagnose. But what actually happened in the patient is a long way before. There is abnormality at the organ level. Before that, abnormality at the tissue level. Before that, abnormality at the cellular level. Before that, abnormality at the protein level. Before that, abnormality of the at molecular level. So for each abnormality, all this, we will teach you what it is, why it is, how it is it reversible or not, is it preventable or not. It is very difficult pathology, yeah? Don't you, isn't it? Is it difficult or not difficult? But it's interesting, I can tell you. It's very interesting because you will learn about Italy. Okay, I'm glad. Many of you. Do you all like it so far? Do you like pathology? Yeah. Good.
Yes.
All right.
So far, so good.
Okay. Now, why is this not moving? Right? Why it is not moving? Oh, okay. Okay, now I just tell you a little bit, just to digress a little bit. As pathologists, later on when you become doctor, and then if you are very interested to become pathologist, you are very welcome. I hope many of you will become pathologists. What is the role of pathologists? We do prevention of diseases and like screening, and we educate the public and the health personnel. We have influence to industries because we drive industries, we do research, then finally the products, and then finally sell the product from industries. Wrong spelling there. Example, very common example is ERPR, estrogen receptor, progesterone receptor, that lead to a drug called tamoxifen in breast cancer, HER2, Herceptin in breast cancer. And we manage patients, either we give diagnosis, histopathological diagnosis or cytopathological diagnosis, or frozen section when the patient is undergoing operation, we give diagnosis on the spot. And then we audit clinical service by our colleagues, other colleagues. For example, radiologists, you normally see shadows, we confirm what is their suspicion. And then we also confirm the physician's clinical suspicions because we see the biopsy they give us, then we confirm the diagnosis. We confirm what the surgeons, when they remove cancer, we confirm the name, the diagnosis, what is the name of the disease the patient is having. In fact, oncologists wait for our diagnosis before they can start treatment. So that pathologist is very important position in the hospital. And for orthopedic surgeons, for gynecologists, and of course, sometimes we also give a review among ourselves because we want to see whether there is cytology, histology correlation. These are the diagnoses made in different forms. So we see whether one diagnosis is comparable with another person's diagnosis or not. Okay, and psychiatrist. I give you a story. I know many of you like story. What's the time now? Okay, I have another 15 minutes. Okay, I tell you a story. I know students like stories and they remember longer. When I was young pathology some years ago, all right, we had a patient admitted in psychiatric ward in USM. Okay, the patient was a soldier. He came because of aggressive behavior and the wife couldn't stand him anymore and bring him to hospital. And in the hospital, because of his aggressive behavior, they thought that he's having psychiatric problem, and he was admitted to psychiatric problem. In the ward, in the psychiatric ward, he sneezed. One of the session with the nurse, sneezing, he sneezed and there was a block of tissue that come up from his nose. And the nurse pick up this massive block that come up from the nose and sent to us pathologists. We diagnosed he had a very aggressive brain cancer from that. So you can see that even psychiatrists, when they don't take the history properly, don't examine the patient properly, they can miss the diagnosis. And sometimes patients are lying. Okay, so patient also, I can tell you a story about when I was working in University Malaya a long time ago. We had a university student who was found collapsed in the bathroom, and she was rushed to emergency, and then emergency craniotomy was done. They opened the skull and see what is wrong with her, and the surgeon removed a clot in the brain and sent to us. And then we diagnosed the patient having a certain cancer of there is metastasis to the brain, but the origin is in the uterus. And this cancer always associated with either pregnancy or abortion, whatever. So we asked the surgeon to ask the patient whether the patient had been pregnant before or not. So Dina said no sexual intercourse. So, the patient said nothing. I said, and we told them this disease is called choriocarcinoma. Choriocarcinoma, there's no way you can get it except with having SI. SI, later on we learn about this term. SI is sexual intercourse, man and woman. To have that, and finally, after asking and all that, then the patient admitted that patient had SI and then underwent abortion. Okay, so meaning that we can tell patients are lying to us. Okay. Now, what are the books you need to learn pathology? These are the books. You can choose any of these books. There are many. I think this is the old 8th edition, maybe probably at 9th edition now. So these are the books that you need to learn, and you must buy, because I think until you become doctors later on, this book is very useful. So you can buy this book. And finally, ladies and gentlemen, what is the summary of my lecture? You, in healthy person, you will learn anatomy, physiology, biochemistry. And then in pathology, you will learn everything about sickness, how become sick, the names of the disease, how the disease develop, and how the disease can revert them. And then if the disease are severe, what make the patient to die. So all this in these two circles, sickness and death, will teach you, and that is pathology. So I will end up my lecture with a poem. This which I wrote myself. So you can go to my poem hunter. My poem hunter is my poet name is Noor, Noor, Noor Osman, Othman. So can go to poem hunter, look for Noor Osman as the poet. So I read to you now. The title is Clinicians and Pathologists Coexist. While the psychiatrists talk and talk, the clinicians read, then take a walk. The surgeons draw on their patients with chalk. The pathologist's routine is never ad hoc. The pathologists go home feeling happy. The surgeons go home feeling grumpy. The pathologists perform genetic testing. The patient's families get early warning. Standing tall in gleaming white coat, clinicians do round on patients they dote. Reading samples, pathologists devote, at times too many, but no time to gloat. Looking intensely through microscope, at times pathologists are unable to cope. When diseases are complex, they cannot mope. Giving timely diagnosis is what they hope. Mixing blood, serum, or body secretion, pathologists discover genetic mutation. Clinicians receive the news with elation. The case can now be written for publication. Staying up late to see experimental curve on herbal cancer and cardiovascular reserve. Diabetes, psychosis, and sciences on nerves, genetic motifs they have, pathologists observe. There are many chores pathologists do using microscope studying cells and tissue. Autopsy, frozen section are never an issue. Glamour is not what they usually pursue. Habis, thank you very much. Any questions to me? I hope that is enough. A good topic, pathology, that will make you want to become pathologist or one make you want to learn pathologist later on. Okay, any questions? We have 15 minutes. You can ask any questions. So I'm glad I finished my lecture early.
Doctor, I have a question.
Yes, who is talking?
Zahra,
Zahra. Yes, Zahra.
the password of e-learning
Mhm.
for attend, we have to put password.
Password for ELAN.
Yeah.
The one that I put up, is it? I don't understand the question, Zara. The password for ELAN, I think everybody has their own password.
No, no,
No,
no.
for the attendance.
Oh, attendance. Okay. For attendance, I am. Okay. Nur Nazira, you are the control director. You are the class monitor. I didn't take attendance because I tell you what, I do not believe in taking attendance for students. You have to learn at your own initiative. Taking attendance is like forcing you to do what you don't want to do. So, but don't tell this to the administrator. The dean one, he ought to take attendance. So please fill up the form to take attendance, okay? But I don't believe in it. To me, you have to do everything at your own will, and you do it because you want to do it and you love to do it. And I suggest you all do that. Okay. So Zahra, I hope that answers your question, Zahra. Okay. Any other questions you want to? No, doctor, I have one question. Let's say someone got stroke and the brain cells did not get oxygen. Let me read. Okay, I have a question. Oh, there are a few questions. Zara from Saudi Arabia. Okay, I can't hear you, doctor. Zara, are you okay now, Zara? Do you have a?
Yeah, yeah.
You did
Just,
you?
just around 2 minutes or 3 minutes, I couldn't hear you very well, but then it's okay.
Right. So did you miss a lot of lecture?
No, no, no. Just
All right.
have
Okay.
on one.
Okay. All right. Then the first speak, not normal, some symptom around the nails. Okay, you were answering the question. And then the question, let's say someone got stroke and the brain cell did not get oxygen for, let's say, 6 hours. Is the brain cell necrotic, doctor? Brain, you remember, as I said, different cells withstand different injury differently. For brain cells, 6 hours is very long. Definitely be dead if the cells are not having oxygen. So every cells, but the exact number of minutes, what is it? You have to learn physiology about that. That's why I said you need to learn the knowledge of physiology in order to understand pathology. Yeah. So Nur Nazira. So first of all, the principle is every cell different to injury differently. Okay, your skin, by the way, why do you think God create our skin that have a layer of wax? There is a layer of wax. Keratin is wax, on the surface of the skin, because if the skin doesn't have this protective waterproof material on it, imagine when you shower, all the thing will get absorbed. You will become bloated, you'll get water. Just like you're in the gut, there is no keratin lining. So things get absorbed from the lumen of the intestine right down. Whereas in the skin, they cannot afford to have that, because so many, otherwise we will get injured so much. As it is, will still get injured by, like you are, for example, you're exposed to ultraviolet light, you go to the beach without wearing sunblock and all that, the ultraviolet light is injuring your skin. Your skin can die due to ultraviolet light. We will teach later on when a pathologist teaching you about skin cancer. They will teach you on that. How the ultraviolet light can cause damage to the skin. All right. Okay. I hope that answers your question. Any more question? So far, are you all understanding my lecture? Uh,
Yes, doctor.
Okay, any particular part that you do not follow, you want me to repeat, since we do have time for 7 minutes? If I give you a quiz right now, um, etiology is A, the cause of the disease. True or false?
True.
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 B, the outcome of the disease. True or false?
False.
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 Betul?
It's
False.
prognosis.
What is the outcome called?
Prognosis.
Prognosis.
Prognosis. It's the appearance of the disease.
False.
Morphology.
Pathology.
Pathology. Okay. It's is the behavior of the disease. Is etiology the behavior of the disease?
No.
No. So what is behavior of the disease?
Pathophysiology? Is it?
Pathophysiology? No, no. Behavior is how bad or how good the cells are behaving in the patient. Say, for example, behavior, maybe I didn't, okay, now I know which part I didn't explain well just now. Behavior is implying the, the aggressiveness of the cells that are diseased that will cause further damage on the patient. Okay. Say, for example, the patient have cancer. And we look at the cells in histology under microscope, we see, oh, the cells are big. The nucleolus is present, and the nuclei are big. So we know that when the nucleus is present and nucleolus is present, the cells are very young, meaning the cells are growing very fast. And when they grow very fast, what are the indicators that they grow very fast? Number one, the mitotic activity will be increased. So you see a lot of mitosis in the histology. Number two, the color will be dark. There will be hyperchromatism. So all this detail later on we'll learn. You will learn. But I'm just telling you how to recognize the behavior of the cells. Whether it's going to be a bad behavior or not a bad behavior. So the cells that resemble very much like the parent cell, meaning looking very much like the normal cell, this is the good behavior. The one that is departing away from the appearance of the normal cell, That is bad behavior. That is essentially what it is. Do you follow?
Yes.
Yes,
So,
doctor.
yes.
So,
Okay.
okay.
Do you understand? I can see a bit hesitancy there. Those who don't understand, just angkat tangan. Those who don't understand, just raise your hand. I can repeat my statement if you don't understand. No? Okay, so all of you understand. All right, okay, good. Any more questions?
Doctor,
Yes,
I have a question.
yes.
About the
You
attendance.
identify yourself because I can't
I'm
see who.
Sangirta.
Who?
Sangirta.
Okay. Okay. Go on.
Okay, about the attendance, it's actually compulsory for us. So if we don't put it, we will be there absent. And the administrator will know that we're absent. So then the doctor will cancel it. Yeah,
All
so
right. Okay, Nur Nazira, is there a way that you can mark the students who are present today?
I think no, doctor, because we are supposed to have the password or QR code.
Oh, okay. So, and I didn't do it as I said. Never mind. I will. Don't worry about that. I will explain to Associate Prof Zul Izhar, the one in charge of phase one. He knows because he knows that I do not like. I will tell him to mark for you all who are attending. By the way, Nona Zira, who is absent in this class? Is there anyone absent? Maybe Nur Nazira, what you do is you just email me. By the way, you have my email just now. My email. Did you get my email address just now? hayatikb@usm.my. Whoever want to ask me question, you can go there. hayatikb@usm.my. In fact, my email is in your timetable, isn't it? And what you do is, Nur Nazira, you just tell me who are absent, and then I will just tell the coordinator, the phase one coordinator. All right, because I really don't believe in filling up the form because some people just fill up the form and leave and without understanding what the lecturer is talking about. So, all right. Okay. If no questions, we'll say goodbye here. And I wish you all the best. And hopefully, I don't know when are you all, do you all have any idea when you are coming to campus? You have any idea? No
Not yet,
idea.
doctor. No idea.
We also have no idea how you will come, when will you all be able to come to campus. So we all miss to see students here. Well, the higher students are here, but you're not the first year yet. All right.
Doctor,
Yes.
I don't know how to go Malaysia. Not in the campus.
Oh, you mean not in the you are still in Saudi, right?
Yeah.
And well, is it not allowed yet?
Allowed, but they stopped my visa. I don't know why.
Oh, then you better talk to the administrator. I think Dr. Zul Izhar is. I will ask Dr. Zul Izhar. You are Zahra
Okay.
Hussein Alhamar, right? Yeah, I will talk to. I will find out whether if there is anyone in medical school knows about your condition. How about the other two from foreign students? Are you all okay?
For me, Professor, I'm already in Cotabaru.
Oh, okay, Omar, you're already in Kota Baru. We used to have a pathology student named Omar as well, but you know him? But he has graduated last year. He is now back in Saudi, but he's a pathologist now. All right. So Zara, I don't know. I'll find out from Zul Izhar what is happening, why you are not getting your visa. The other one, that one
Okay.
from, yeah. Okay. All right then.